I am Dr. Rehan. I am a colorectal surgeon. I am working at REHAN Medical Center, which is a daycare setup for laser treatment in the field of proctology. Just talk today about which is a very common complaint which the people suffer with bleeding of rectum, bleeding from the rectum, and most of us know by the name of hemorrhoids. In the layman's term, it is called as piles. Let's understand what it is. Hemorrhoids are the tissues from the anus which slides down. Normally they are present in everybody, and normally they are 3 in number, 2 on the right side and 1 on the left side. And when they get engorged with the increase in size, they start sliding down and started coming out of the anus at the time of the act of defecation, and most of the time they even bleed. And sometimes, if not been treated on time, they can go for complications, like they form a clot inside the piles, which called as a thrombus pile. They can get even infected, and they profuse blood, leading to anemia, chronic anemia. So they are the cushions of our anus, which slides down, and they get engorged because the veins are involved there, along with all the muscle fibers. And the patient will come with the complaints of either they will tell the bleeding from the anal side for a long period of time. They will also complain of swelling, which they can feel, which comes in outside and goes back. In the advanced stages of the hemorrhoids, like grade 3 and grade 4, they are unable to push it back. It stays there. And most of the time, these patients will have a history of constipation, which is very chronic. And most of the time, they even with a history of sitting for a long time. These are major 2 factors which can bring out the disease of piles or hemorrhoids in them. There are 2 varieties of hemorrhoids. One is internal and one is external. As we have discussed, all these things will lead to internal hemorrhoids. And the external hemorrhoids mostly we see in individuals who sit for a long period of time. When these patients come, there is no extra investigation or test done for that. It's just a clinical examination. We do a endoscopy and we diagnose the pile. And once the pile has been diagnosed, then the treatment is that we do especially we do a laser surgery, a laser procedure here in REHAN Medical Center. The conventional method is to do an excision, which is quite painful. It takes some time, 1.5 months to heal. But with this latest technology of laser, we call it as a laser hemorrhoidoplasty, LHP. What we do is, with the help of this technology, we inject the probe of the laser inside the hemorrhoidal tissues, and we fire the laser. The thermal energy is being given to the bile tissues, and that's the only thing we do in the operation theater. In a week's time, or 2 to 3 weeks it takes, depending upon the grade of the bile that we have fired, the bile mass will start shrinking and getting smaller and smaller and disappears over a period of time. So there is no role of any cutting, there is no role of any suturing there. That's why the patient will have a very good recovery period, where they will not complain much of pain. There will be slight uneasiness and all, because some procedure has been done. And the only thing we tell the patient not to have a straining and not to sit for a long time. We keep them on a high fiber diet, a lot of fluids, liquids to be taken orally, and some physical exercise. And that's how it's been treated. And we treat all the grades of piles. Thank you very much.